Well, you've probably had it, or most likely will at some point in the future, back pain. Treatments vary dramatically from bed rest to surgery, and it turns out rehabilitation may require different strategies as well. Tonight, some tips for coping. Growing up in Hawaii, Scott Davenport was an avid surfer. Recently, he's been hitting the water again, this time to help him recover from surgery.
In order to swim, you need to twist your head, and retaining my motion of being able to twist my head is very important to me.
Here you can see one of the bone spurs pressing on the spinal cord.
San Francisco spine surgeon Dr. Kenneth Light performed a multi-level disc replacement on Scott just weeks ago. He says regaining range of motion after a back procedure or even a simple episode of back pain can require specific but very different types of rehab, beginning with classic lower back stretches.
Lying on your back, pulling one knee up into your chest, then pulling the second knee up, then pulling both knees up into your chest. What it does is it rounds out your back, and it causes the joints to unlock.
In the case of surgery, Dr. Light says the goal is to avoid the formation of scar tissue after the procedure. In Scott's case, the disc replacement left him with enough neck movement to begin stretching the upper spine and neck region.
Usually we have them try to touch their chin to their chest, put their head back as far as they can, rotate their head in each direction as much as possible.
But rehabbing from another common surgery, spinal fusion, can require a much slower start, typically after several months of rest. That's because of the need to allow reconstructed bone to set, along with screws and other hardware used for support.
And if you're too vigorous in the rehab in the beginning, the plates and screws will loosen, which will lead to incomplete healing or a lack of fusion. So some type of isometric strengthening is usually good for the neck and back. Abdominal crunches are good for the neck and back. Anything that doesn't require repetitive bending and lifting that will pull the screws out of the bone.
Dr. Light says the best low-impact exercises are swimming, walking, and bike riding, and in certain cases, elliptical training. Scott expects his ability to get back in the pool will speed up an already smooth recovery.
I didn't swim a mile, I swam shorter, but I feel great. I have full range of motion.
As far as you can to the right.
Now, research shows most cases of lower back pain resolve themselves in the first 3 months with a combination of rest and anti-inflammatories. But if the pain lasts for 6 months, the odds of spontaneous recovery go down to 50% and then down to just 25% after a year.